Hello everyone and welcome back to my channel. I'm a seasoned medical professional and I'm here to bring you the juice like no other. If you're a returning subscriber, this is me saying thank you for your love, your comments, your loyalty. If you just stumbled on this channel, this is me saying you're welcome and I love you too. So today we'll be looking at reasons why men develop breasts like females. Let's roll in. Welcome back. In today's class, we are going to be talking about gynecomastia. Gynecomastia is when the breast glands in the man increase and resembles that of a female. And it could occur in one breast or in both breasts. Now, what are the symptoms that a man has gynecomastia? There's enlargement of the breast tissue. That means his breast increases in size. His nipples are sensitive. You have pain in the breast and also breast tenderness. In fact, it feels almost like a young girl at puberty. You remember that hard knot that a girl going through puberty develops when she's developing breast. That's what men with gynecomastia go through. Now let's look at the different stages in a man's life that he can have gynecomastia, or different stages that could cause a man to develop breast like a female. The first is at birth. Now, when a male child is born, he has higher levels of estrogen than testosterone. And this is because he gets it transferred onto him from his mother. And as he grows older, then the level of estrogen drops. So this is very important. But this stage of gynecomastia, or increase in the breast gland or breast gland tissue in a male, finishes almost at toddler stage, ends almost at toddler stage. Now, the second stage in a man's life where he develops breast gland tissues, or where he develops breast that resembles that of a woman, is at puberty. And this is because his body is changing. His hormones are going through a lot. And this doesn't occur in every boy or in every male, but it occurs in some males. So when this happens, it's good that you should know that it's going to clear off with time. But if after 2 years, you're still having this breast tenderness and tenderness of nipples, I think you should see your urologist. Go see a doctor and get some help. The next stage in a man's life, when you expect him to develop breast gland tissues or have an increase in breast size, is at andropause. It's when the man is at an older age, like 50, 55 plus. And this is because his body produces less testosterone. And that affects his body totally. In fact, the level of estrogen in his body at that time is normally higher than the testosterone. So this is what you should know. When you find a man of a particular age developing breasts, know that it is normal. What are the causes of gynecomastia in men? What could cause a male to develop breast gland tissues or to have an increase in breast size? That is not normal. The first is obesity. Now we all know that obesity has an influence on our hormones. And this goes for females and both for male. Most women who are obese struggle with fertility issues, and so do men who are obese. Their hormones fluctuate. So when you find a man that is obese, normally the fat plays a role in altering the normal hormonal flow in his body. And also, fat tissues also find a resting place in his breast area. Now, the second is hormonal imbalance. Yes, males do have hormonal imbalance as well. Normally, every male that is born from birth gets a transfer of estrogen from their mom. And as they get older, their testosterone increases and the estrogen drops. But the estrogen doesn't disappear totally from their bodies. So when you find an adult or a teenager with breast, that means the estrogen levels in his body could have risen and his testosterone levels would drop. And men who experience this have serious fertility issues. The third reason is tumor on the pituitary gland. When a man has a tumor on his pituitary or an abnormality on his pituitary gland, it affects his hormone production. And this is same for a lady. So at a certain point, he's going to have extremely low levels of testosterone and higher levels of estrogen, and that's going to cause him to produce breast milk. Now, the fourth reason why a man will develop breast like a woman or breast of the size of a woman is also adrenal tumors or abnormalities. The adrenal gland is found on the kidney, and it's very, very important in the body in regulating certain hormonal secretions in the body. So this tumor or these abnormalities on this adrenal gland could cause the body to produce excess hormones. And in this case, we're talking about cortisol. This could cause the body to produce excess cortisol, and this will affect the level of testosterone in a man's body, and it will cause estrogen levels to shoot high. So what should you do if you are experiencing this? What are the treatments for this? First, the treatment will depend on the cause. Now, if you're obese, make sure you lose some weight, you eat healthily. That's going to help, really. If you're obese, you will need to lose weight. You will need to eat right so that you will lose some body fat and then your breast will go back to normal. And also, it will help that your hormonal levels are stable. Now, if it's a tumor of the pituitary, the doctor will give you cabergoline or any other hormonal drug that is on the market to able to suppress the production of estrogen in your body. There are different types of drugs that will be prescribed for you. This cabergoline will shrink the tumor on your pituitary. And there are other drugs that will be prescribed for you if you have an adrenal tumor or if you have adrenal abnormalities and also hormonal imbalance. That could always be regulated by some drugs. Now, I'd like to tell you the side effects of these hormonal drugs is very disturbing. So you need to calculate the risk of doing a surgery, particularly on the pituitary, to take out the surgery. You need to calculate the risk. I know the drugs are not that friendly, the side effects are not that friendly, but give yourself a year and see how it goes. But before you allow a surgery to be done on your pituitary gland, you need to really, really assess the risk, because just a small friction on the pituitary could mess up your entire life, and you may be living your whole life on medications. So thank you for joining me in today's class. I remain your seasoned medical professional, Gwendolyn Halle. Bye-bye.